In the context of a lower quadrant screening exam, you might need to do the special test of IAPP, which is inspection, auscultation, percussion, and palpation. And in this case, we have a patient who has a nice abdominal scar, and we'll pretend that you had a AAA repair, and we're checking to see if everything is healing well, there's no sign of a bruising or anything like that. So with inspection, what I'm doing is I'm watching Matt's respiration rate, I'm watching the rise of his belly, and if he's lean enough, I can watch for heartbeat. And if somebody had a pulsatile mass, that might be the sign that they actually have a AAA. So if you had a patient with back pain, ruling out this as a urgent referral would be a good thing to know. So I inspect, and I'm looking for, are there any signs of muscle tone or spasm, any asymmetry in the stomach. Then the next thing I'm going to do is I'm going to auscultate. And auscultation is performed to listen for bowel sounds, so worried about if there's any sort of obstruction. So what I need to do is go into each quadrant and be nice, warm up my stethoscope. And if I come down into the right lower quadrant, listening for bowel sounds, and whenever you auscultate in the abdomen, you really need to kind of hang out for about 10 to 12 seconds in a quadrant, because peristalsis is a slow motility type thing and typically will happen every 12 seconds. So I can just work my way around the quadrants, taking the time to listen. 10, 11, 12, come into the quadrant here, make my way around. And I actually hear something. Hear your lunch working. And then the lower, this descending colon over in this region. I can also auscultate for a bruit. So if we know that the aorta comes down the midline, I can come in here just off left of center, and I would be listening for any type of whooshing sound that would be accompanied with a bruit if you had an aneurysm and there was some backflow in the artery itself. So we have inspection and auscultation. Next up is percussion. And percussion is a technique where I'm going to hunt for organs and make sure things are in their appropriate places and have the appropriate sound. So if we come over here on the left side of the body in the midline of the rib cage at T9 to 11, we can get the area of the spleen. So if someone had maybe had a trauma, blunt force trauma, and we were worried about a spleen that had been ruptured or swollen, I could palpate and I should get a dull thud over the organ, and then it'll sound more hollow when I'm not over the organ. So you can actually tell the size of the spleen. Okay, the stomach is in this region as well, so it should sound relatively hollow, depending on when you ate last. Okay, whereas if I come over here on the right side of the body, this is where the liver lives. So in this region, I should have something that sounds a little bit duller versus kind of that hollower sound where the stomach itself is. Okay, and I could actually percuss different regions of the stomach, looking for size of organs and sound. And then the last thing I do is palpation, because it's the most invasive of the procedures. So you start out with just a gentle palpation, feeling again for tone. If I want to do some type of bilateral comparison, I can also palpate respiration. I can palpate again for the width of the pulse of the aorta. And if it starts to migrate far laterally, again, I'd be worried about an aneurysm. Then with this gentle palpation, I'm just finding out if there are any tender spots. And then what I'm going to do is some more deep palpation. And when I do this, I'm going to push in and I can pull back. And that's that concept of rebound tenderness. So let's say Matt had a appendicitis down in this region and he was sore in that right lower quadrant. I could come opposite that and do this. That would just move your organs toward the appendix, and when I release, there'd probably be more pain because of the reverberation inside the abdominal wall. And that would make me suspicious that I might need to refer this patient. So that's the IAPP exam: inspection, auscultation, percussion, and a soft and deep palpation.